speaker joining. So he has joined us. So in our midst we have Dr. Kanu. He's a physiotherapist. Ọgụlụ akwụkwọ na Unizik. And ọ nwekwa anọ ebe ọ na-anọ. Ọ na-agbatịsị ndị mmadụ ọkpa. Ọ na-akpụ ya Oasis Care Consult. So I've followed him for a while, and I've seen him help people. Monday Bajilaka, Monday Bajilaba. You know, there are some things. Oh yeah, before physiotherapist, physiotherapy. A malo na chuku na ekwarande mmadu uche. So when money na bankata, he was talking to me of how slow to see MSC, even my young boys. So I reached out to John. I was telling John about it. I said, I'm not going to mark our men more about these things. Because the essence is that now only one didn't do because I even them on time or on time. So John has always pioneered this. His goal is that all our set today healthy, so that in the next 20 years, AGM only next 30 years, next 40 years, so anything over again make a that to achieve, I can able to take a group so that as prevention is better than cure. So while I was talking with the Dr. Febo, now I'm 20 years now I took a stroke. So I felt it's something I get within our group. So at the end you have an that game will lead you to stroke. I may avoid. But can early signs. If you don't know where treat it be, you know. So I want I join whatever number that. So I need again and then on you now money and you head here for none and then no for none because at the end of the day I got a job then I got to buy my house. And I won't give away. I get so I pay attention. All right, Dr. Febo, the floor is yours, sir.
Okay. Thank you very much, Ak. Good evening to every one of you. My job, so I pay my video. Here, and I'll switch to share my screen as well. Okay. All right. So I want to confirm, Unana, for my screen is my screen clear? And I feel. Let's see. Can my screen be seen?
Yes, sir. Yes, sir. We can see your screen.
All right, first of all, I want to say a very big thank you to every one of you that made the time to come in to listen. Emma, in the buy na river Asina. Sorry, okay, I don't know if you can hear me audibly now. Can I be heard? I don't know.
Yeah, you can hear you.
Yes.
Yeah, so on our column, we get access to certain information, especially information around our health as we and we're growing statistics of a lot of deaths amongst specific genders, especially the male. Or this year, you now check around. You know, we can abunu now. So landlady, landlord, and it's happening everywhere. Even all can be now. So landlady can move on. I am one of the landlord. address, I don't know, they go on you get, and it's a growing anomaly. It's something that must be corrected, and that is why I applaud said to Unu for deciding that okay, you go and look for access to information, basaran health, and then you find a way to ensure on the safe side. You know, I said some of the things I will be pointing out now. About first time you get go, yeah. I'm sure that even because I had at some point in time, I know it's not the first time. Anyway, a lot of people that have devoted their life to bringing this information to people. But about first time we've heard it. But I want at least.
Can you remove the picture in your display?
Amor.
Yeah, we picture in your display. My picture in your display. Just
Let me see.
I just share it again.
Okay, let me see. Okay, I feel what happens is Abona. Okay.
Yeah. Oh.
I think once somebody starts talking, the person will pop up on the display. So what you can do is just pin my contact to the top. Somebody can do that for me.
Okay. Just done that.
Okay. All right. Okay, so I was saying, for example, now I think 2025, I lost a 26-year-old guy. My body a man because 26 years old. He had a kidney. And imagine certain other conditions. Okay, currently last week, I got a museum and I met a guy. Clinic. So he took my contact. So I was just going around evangelism and publicity. So we meet here. I saw him walking like we go stroke. So I walked up to him, see how far can we with stroke and something stuff like that. Or say more, it just happened a few months ago. And then I now asked him questions like that. And Jose Arrow, 33. So enjoy, okay, what possibly could have triggered it? Because we're going to look into it. And when he said it, there was this remark on his face like he couldn't believe it. I mean, not stroke. For him, in his mind, he was thinking anyway, spiritual connotations to these things. But as you will come to realize, as we go on with these things, you will realize that these things are more physical than spiritual. And even if there are spiritual connotations to these things, they are mostly routed through physical parameters. If they come for you, and most of all these things we will point out are in your house, there will be no way. Come out just saying hands, but you see in kind of stroke, it is something that is very easy to manage and it is something that can be prevented. All right, so with that, that's the introduction to the slides. So now, like I was saying, stroke is no longer an old man disease. Now, younger people now stroke. I mean, we go 26, at least give or take 26 to 30 patients since we opened this clinic here in Oka. I will tell you that maybe. Sorry, excuse me. Let me see if I can do this. Okay. Majority of them, younger set of people. Yes, majority of them were younger set of people. And I'll tell you why it's happening like that currently. Before, statistics I not even well, at least you go 50 something, 60 something, only now retires. Because now only a possible physical activity. Most of those things now catch up to them in older age. But because of certain things we started introducing into our system, into our current practice, the age disparity about that zero format. So you're seeing 20. I have seen an 18-year-old boy call a stroke. So anyway, certain risk factors are combined in our hand. You see that it can happen to anybody, why, whether the person is old or young. Okay, so the statistics: 1 in 4 persons are go stroke. In fact, I was speaking to one of those classes, one of these other secondary school, invite that I was speaking in there. how I got the opportunity to speak there was one of their classmates, CBI stroke. So they invited me to Regina. I started seeing the guy. The guys were going in the class and they said, yeah, and several other things. No one and it's true. You now, you go to main market now. If a lot of people are beer, sugar, kids, cholesterol, kid, check away, check it. People check it, but they don't understand the correlation between those things and a check with chances of them coming down with stroke or any other cardiovascular accidents. Right? So next slide. What exactly is stroke? Because this one will save us a lot of money. Especially in Anambra State, there is this growing problem there. Mmadụ ya nara stroke. First thing I got Bruno ya gabe Enugu ukwu, Bruno ya gabe Enugu ukwu. No offense to those people that practice those things they practice. Amakwam they produce some measure of results. But from the definition of stroke, why those things don't used to work. Because the truth is, if they don't work, don't here. So most of the people I see, if there's enough for akakachala haka, kakacha ha where he had teacher, hands. There was this patient that got into a coma on her book. When I met her, finished the assessment, kinda I noticed that nowhere this big bottle of Eva mix is a concussion. Enjoy the woman, he borrow this person go now. And then she was like, nah, don't know what that was stroke. And I said, why did you now invite me? Because I cannot work without those other people. I said, no problem, I got where going on. She went to chemist, say no got on her Facebook, no one particular drug and end this stroke. She combined that drug with Ogwibu. Say actual side. Her mother went into coma till today. I know these small practices. Oh yeah, but it costs you way more than you had initially bargained. So a stroke is a type of cardiovascular accident. Completely. It's a cardiovascular accident that occurs as a result of reduced blood flow to the brain. Friends, I want you to understand that the brain is the most important organ. In fact, every other function, the brain is alive. So at certain points in time, in distress, blood volume low, the whole body will prioritize sending more blood to the brain than any other part of the body. So Abiazie now send the blood to the brain. Obozie no we mereno that the pipe in their channel, that thing about arteries and veins, let's send the blood to the brain. For some reason now, it's blocked. It takes only 8 minutes of blockage of blood flow to the brain for the brain to become completely brain dead. 8 minutes. So in how about something now from now say once it is 8 minutes, no need. Dump. That's how sensitive this thing is. And that is why when we come to the practical aspect, there are some things about everybody get bunisi because you don't know when you will see somebody that has stroke. I will tell you my own personal story in my own father. At which point, if I didn't have this knowledge, my father came in a biaria room. So stroke happens once blood flow to the brain is cut short. I will want you to think of the body like a plumbing work. I've been a plumbing work now. Let's assume name where sumo na begi now. And where the sumo is in a pump mmiri from inside the ground. Then when the pump here to the tank. Then from the tank you can distribute it. You find out that the sumo requires energy, right? It requires light source to pump against gravity and pull out water, right? Now, that thing is what the heart does. So the heart is likened to the sumo. At any point in time, let's assume now, go sumo, the number of tanks they go in the building is not commensurate. Maybe they go 2 tanks for like maybe 5-story building. You now find out that the amount of work okay place on the sumo guy is so much that every minute of the day, the sumo now pump to sustain water. It gets to a point, the sumo breaks down. I think a sumo maybe go. These are the things that happen. And that's the same thing that happens with the heart. So at any point in time that the heart now starts taking up more load than required in a bid to meet up with the demand of supplying blood to the brain, as easy and where those things are about heart attack, heart failure. But sometimes it will not lead to a heart failure. All of a sudden, the heart, because that's what will happen if the sumo voltage is not high enough to pump a bigger sumo. Now, let's assume that you get a bigger sumo. Now, what you will now see is that the pressure from a bigger sumo will be different from that of a smaller sumo. So you see somebody now, the person at 33 years old, they make physical fitness, they make jogging and all the rest of them. Except to lose or bacha boy, except to lose get settle your man free before you know it or broga or go moto. You now find out that physical activity, before you know it, physical activity was once in a while. That's why some of us never I forget potabago. Ige aka go we say never to take it inside. Obuno ge receive madu 247 and no jogging now everything will go down because it's very important. It will help you. Now, obviously, that those things start happening. Those physical changes, remember that the heart already in Tony Tobago has fully matured. And when see any other increase or game in size, except for increasing abnormally, because all planet chala the amount of size of was able to meet that demand when you were 33. So as you kept on increasing body parts, the next thing you now start to see is that the metabolic demand, the demand placed on the heart to pump more will increase. And when it increases, mind you that the blood vessels, the remaining pipe, go to wire and supply to the entire part of the brain, did not increase in size or strength. So what happens is increasing in the heart will all of a sudden increase the pressure that is going to the brain. Before you know it, boom, pipe abawa. And where the pipe bursts most of the time is in the place where the pipe can be thinner or tiny, and which is at the brain. So the brain has the tiniest set of blood vessels. And then back, pressure increases in the heart, it blows up at the brain. And once it happens, that person comes down with a hemorrhagic stroke. And then there is this thing that used to happen. Normally, we don't used to argue because and when you had a partial stroke, actually, the intention of stroke, I will come to that. Hemorrhagic stroke will happen in that particular pipe, very close to where the pressure met it first. You now see that two things start to happen. One is that blood will start pouring out into the brain. And the brain is so sensitive that anything that starts pouring or touching those sensitive parts of the brain will cause those parts of the brain on a method to start dying. So open aqua funara to the outskirt of the brain, you start seeing those places dying. And the second thing is that because on aqua is somewhere, there are groups of part of the brain that is now not getting supply. So one side is having leakage pouring into it, and the other part is not getting supply as a result of it. So those two sides will start dying. That's what happens immediately mad your stroke. And that is why when somebody comes and tell you, see, how will he transfer to the brain and go and seal a leaking that is happening in the brain? And that's why a lot of times we don't recover from strokes fully. If we recover from stroke, you're still seeing the presentation, no stroke. That's because there's something we're not doing. In fact, I'm telling you. So now, the second type of stroke that can happen is that let's assume that now the problem is not in the pressure. Because the pressure now comes as a result of, let's assume, and then the increase in pressure. Now, let's assume that the pressure did not increase. But now, all of a sudden, the pipe, there's switch. And the things now switch fat, those parts of the pipe. Now, Bokari fat, aquara, and the rest of all those things. You eat it. Airborne is inside those pipe that is supplying to the brain. And it gets to a point, the amount of fluid that is now flowing to the brain will start reducing. It gets to a point, some of them are so much that blood will not flow inside. Only a stroke, ischemic stroke. So you find out that if you understand basic plumbing, supply and demand. Abona side that these guys will not have. MPA had there, but these people will get. You will understand what exactly happens in stroke, so that people will not deceive you and confuse you, especially when it matters the most. So those are the two major ways strokes can happen, right? Next slide. Now, if you don't remember anything, when you for this meeting and you remember this part, you have saved yourself and you've saved somebody. Be fast. That's the acronym. Now, it happened that there's this hospital known as, I will not call the name of the hospital, but there's this very big old hospital known as Express by Opi Wake, by the right. So one of those days, my dad, because my parents be on it, so my dad wanted to go for checkup. So now at moto, I just joined him, got one at the hospital. So as we were waiting to see the doctor, I looked at my father, and then I was asking him a question, and he didn't respond to the question I asked. And I looked at him. As I looked at him, I noticed that, which is, you see, face, that F now. I noticed that, first of all, his eyes was closed because I couldn't assess the first part, which is the balance. Because some people, you will come out and then you tell them, I say, no, you get, and you tell them to sit down, you understand. Now, if you see that first one balance, and then you see Anya to turn what the person, the next thing you should start looking at is their face. I looked at my father's face, only and bend it to one side. Or they can only and melt to one side. So I was asking him a question. Immediately I saw that face. The next thing I did was to tell Daddy. And this man was not responsive. Inside the hospital, I already knew these signs too well. I started shouting at the nurse, come. I said, this man is having a stroke here. And what happened to him was, he checked his BP, check his BP 2 times. And then, as they were in a pump, they check his BP, he was not already feeling fine. So that thing already reduced the amount of blood flow that was going to the brain. That just within minutes, all of a sudden, his brain started shutting down. I told the nurse, Alpha, this man is having a stroke. Student nurse on Fanunkahama. I said, how did I know? Mbamba push the nurse outside. I said, go and call me the doctor. Nah, I'm a doctor myself. So I told them, get me the bed, get me this, get it. So when there was a command, they now started listening to me. The doctor put us in and that was what was happening as at then. It was easier to arrest this thing because I knew these signs. I looked, okay, I couldn't assess balance. I looked at him. Anya was closing. His face was bending to one side. His arm, can you see that? Stand up. Okay, and usually it will happen on one side because okay, in such a way that if you place your 2 hands on your head, I want us to do this practical so that you understand. But I can now place here on your head. Place your 2 hands on your head. Now, you see your right hand, this, your right hand, on a method at that part of your brain, and your right hemisphere, is responsible for supplying information to the left part of your body. And your left is responsible for supplying blood and every other information to the right side. So now, you could see wire X. So if I come out and see somebody, Abona side bend down is on the right. Akia that is not working is on the right. Okuya that is not working is on the right. Then rest assured, the part of the brain that is being affected is the left part of the brain. And what this knowledge will help you to do is that at least you now know that, okay, I shouldn't be bothering to try to make that right part that is now weak to start working. Because the left part of the brain, they are affected. I can now help the person up by holding the other side. And that's how you'll be able to drag the person out. Because you understand which part of the brain now they are affected in that thing. So if I come out and I see, okay, the eye turning, face bending to one side, the arms in one side, arm and leg, know they walk. And then I now ask the person a question, Alpha, and the person is trying to talk, but I cannot hear the person. And only had that be before. I can rest assured be saying, oh, they call stroke, pneumonia. Then the last one, time. Time is of the essence. Many of the people that died from stroke died because that's why those people come back worse. So time is of the essence. I told you, 8 minutes. That's what it takes for the brain to die. So when you notice these things, you come out and see these signs, you should now start thinking, oh no, where's the nearest hospital I should be taking that person to? And I'll tell you why it has to be hospital that you take the person to. We'll just keep going. Next slide. Now, what are the risk factors for stroke? Risk factors for stroke. Now, I divide all risk factors for stroke into 2 parts. And when they're about modifiable risk factors, when they're about non-modifiable risk factors, I mean modifiable risk factors. Those are the ones that let's assume na na culture ebe man na stroke, na gender na stroke, na family everybody na and where certain things that I can adjust on my own that can help me reduce my risk factor for stroke. For example, now, I say some of the risk factors for fire accident, but now, okay, now maybe kerosene or gas close to the kitchen. So if I want to reduce the risk of fire, I can take out those things from those places. Another risk factor might be no presence of fire extinguisher. If I want to reduce the risk of fire, I buy a fire extinguisher. And that's the same thing with these modifiable and non-modifiable risk factors for stroke. Now, the non-modifiable one could be the bone na stroke, the bone na high BP. Because high blood pressure is the number 1 risk factor for stroke, is the largest risk factor. In Sege BP, this first train I mentioned, you will never have a stroke. There go in the village. Tell your village people. There was a man that came to the clinic. Obona, case. The person said, no, and then, so one day I was a boy on the phone. See, I'll be in I was from one. See, I know we put it off here. Now I make something now. Otherwise, in 7 days stroke. Yeah. So the man bought kit. So he now happened to meet someone that knows me. I brought him to the office. Met I assess every of the risk factors. I did not see any of these things that would suggest this man will have stroke. But then something now started happening. Because usually what these people do is the manipulation they do is that they have to call you on phone and tell you that information. Why? Because you see that thing, in the Bible, you call why faith comes by hearing, and that's the same thing. Fear comes by hearing. Not an area, it will disturb your entire system. So every case I've ever had of this type of incident, I got on a phone, warning. And the open warning, if your faith is not strong enough or your knowledge is not strong enough, if we be a worker before you know that's stroke, Meg. How does it happen? Once they come out and instill fear in you, blood pressure got go. Once your blood pressure goes up, hypertension accounts for majority of the stroke that ever happens to people. Hypertension. If you're able to deal with hypertension, also hypertension can deal with, you find out that the rest of all those ones, let's assume, your incidences of stroke would reduce drastically. Okay, so hypertension, 1. The second one is diabetes. Diabetes now, simple summary, sugar. And the problem with the sugar, if you check, when you were growing up, sugar was not a problem for you. Why? Because some of us now CK, some of us now club. You play for your physical activity levels. I was high, so that upon one soda and one of those things, take all those bottles of alcohol and the rest of them, you find out that your body is able to burn those things faster than it is stored inside. So it's not a problem. But once my physical activity level starts to drop, let's assume I'm never jogging before, I reduce my jogging. All of a sudden, you now find out that maybe one bottle of mayonnaise you find out that we could take 2 weeks to burn it. Some people now will take 3 months to burn just ordinary pork meat, ego. And those things increase the chances of you coming down with stroke. Because on a dozen. So you now find out that usually, athletes, you hardly find them come down with stroke. Why? Physical, especially that period for which they are they are physically fit and in training. But the very moment they leave, before you know it, so it's a huge level of indiscipline to have those things coming out. And it is one of the fastest way to kill you. High blood pressure, diabetes. The third one is cholesterol, high cholesterol. Abokwe ha na Peter Ibiariwa, I say check your cholesterol. I say cholesterol high, this one high. No. There is a type of cholesterol, low density lipoprotein. Low density, the high density lipoprotein is a good type of cholesterol. The bad one is the low density because somewhere weight. And weight can enter those blood vessels, where block all those blood vessels because they are dense. Oh, you can low density. The high density lipoproteins will come out, Dorona, Foge, Doronike, Dorona, and the rest of them. But you see the low density ones, those are the ones that can freely start floating and enter into the bloodstream. And those are the ones, once they have high amounts of low density lipoprotein, chances are it can cause that second type of stroke I talked about in Canada pipe. I don't know if I'm making some sense. Are we still together?
Very well, very well.
Yes.
Yes. Of course.
Yes.
So the first three I mentioned, friends, if you are able to handle these first three, because you look at now, high cholesterol will cause high blood pressure. Because under off a shisha pipe, it will cause the heart to do more work. The same thing with sugar level. Sugar level will increase the level of both nicotine reuptakes and certain neurotransmitters that makes the blood thicker. That if the heart has to pump it, or not pump, see, or not, it's very hard for it to pump out. That's how all of these three are related. So once you start tackling one, you're tackling all of them at the same time. If I say I want to deal with high blood pressure, how do I deal with it? Reducing my sugar intake, reducing cholesterol intake. You now start seeing some other things, especially with Africa, that also cause increase in chances of stroke. You see salt, table salt. Oh my God, table salt. You know, eating spicy. Imana salt, and that's why it affects the ladies more. Salt, table salt. Once it increases, and that's why sometimes some things are not abamara. You see somebody, I think you know, and the person will not check what part of her heart, because what happens when you stop feeling fine? Let's assume that fever be dogi now. Your body temperature will rise. It will now increase the load on the heart. The heart will start pumping blood high. So the blood pressure when you are sick is usually higher. Imagine if it is higher now. Somebody now, I say, give wero Sprite, tea, salt, name. I don't know if they've told you to do something like that before. And that's how somebody will just go and wero Sprite and salt, pour your normal saline with tea before you know it, BP for before you know it, pop, stroke. That's how it happens to a lot of people. So salt intake. There was this period during COVID. It was salt war. It was a war. Bam, that COVID again. Do you know how many people he killed? Aye. So it's one of very, very important as well. Then tobacco intake and alcohol. Okay, for tobacco intake. Studies before, because this is my problem. I'm a firm believer in the Bible and God. African you know, there are certain professions you will practice. You cannot just but help believe in God. Some of these things that the Bible had taught us about alcohol and the rest of them, and you can explain why you shouldn't take it. Science, I again, encouragement. Some people are totally a pistol of Paul. So Paul say, one thing I can't forget. You're not Paul. You don't have the condition Timothy had. And then you're taking alcohol. You now find out that that alcohol, even in minute traces, together with certain other risk factors that are common to Africa, it brings your chances of coming down with stroke. Small alcohol. Even studies has recently shown, they no go publish it, that no percentage of alcohol is good for you. Recent studies. No, before and they reduce the percentage. I said 5%. I think now we occasional. The problem is not that alcohol will take you to hellfire. Chances are it will kill you faster than you should have. And that's why my advice say, don't do this, don't this, or this. No. It's just that the person wants to live longer than you. Alcohol, you see tobacco smoking. Once your nicotine level rises, you see those things. We are taking on characteristics of people that healthcare, cost of healthcare, government now subsidizing her. So you see abroad people, they smoke. Some of them smoke how many packs? We see them on social media, see them whatever, and then we indoctrinate their lifestyle. Lifestyle here we be say ordinary, the barest. There is no government that is currently subsidizing healthcare. There is none. On Peter, they will tell you they are subsidizing it, but you require ban. And we can say card go to 200 naira and as you get somewhere else. So it's one of those big risk factors for stroke, right? Then you now find excessive weight gain and reduced physical activity. Something happened in Onitsha, that I started liking. You see that sit at home because it made a lot of people, especially traders, have the opportunity to come out on Monday and work out. Now, why that workout is very good, you see, getting to burn weight and the rest of them. The problem with those workouts is that not just normally it's not still enough because one of the things we've come to find out is that you see, for example, I take alcohol now and I take like maybe one bottle of Heineken or something. To burn out that one bottle of Heineken, I might need to trek from something like DOBA Weru Seaman to burn out that one. And imagine if I don't burn it out that week. We're talking one or two things. And these things are statistics. I now calculate hand from the beginning to the end. I calculate it. If you find out what you have to do to burn out ordinary in my head, because I was listening to some of our conversation when a video weekend, one or two. You find out that to burn that mechato 1 or 2, you use like 3 consistent days of issue jogging from Seaman to Doba. You understand? So I no go come and advise people because him I gonna advise here. So if you feel like you want to continue, now the reason why I open shop, I can't just so. But let it not be that the reason you continued is because Neymar. Let it be that okay, Neymar go now this thing and then you decided okay, no problem, can marry a geba. You get the reason I'm sounding like this is especially to us men is that like I said in the beginning, I ain't like catch a effect. I mean, as a man, a stroke, your entire family go crumble. In fact, highest your wife will shoulder financial responsibility. We can borrow 2 to 3 years before you know it. I see videos of some wives, and I got the whole, and I say, your head. I say, you see them, you back aye. And that is why every one of us should protect ourselves, whatever it we do, so that you will not fall a victim to these things. Start doing it on time. Okay. So now, men health lens, I will be fine. Now just what they call malaria. Before you know it, you treat malaria and typhoid. Those things are not obtainable again. If you continue like that, you might be missing out on some of the major things that you should have diagnosed and addressed on time. Okay, for kidney, you see your kidney, you see your liver, all those things. I'm gonna science and I go see sometimes the science might be consistent with malaria. If you ever it makes you go malaria or they can define. Sometimes I am with pain that it will only go me one chog. And you know that once you take this drug, before you know it, the drug will wear out from your system. In European America, it took us another one. Instead of going to find out what exactly is causing this pain. Sometimes a headache. Headache can brew is sickness. Headache is a symptom of an underlying sickness. I don't use paracetamol to cover the headache. I find out what exactly is this headache telling me that is wrong with my body. You get? It's just the stress. Yes, I know. But make a routine date to check your health. Upgrade once in 3 months. You say, and then go to my room. I mean, any of us that drives now that doesn't at least know toto before you start to go demote one more engine check. But look at your health. Onye tete no check okwu ya mkpịsị okwu ya na-arụ ọrụ aka na-arụ ya mobile phone before you know it one gaba afia. You get so we don't treat our body the same way we treat our devices. Our device can have on or low, you plug it. Screen guard, the mark a screen ya galon, you replace the screen guard. So we treat our devices, even our assets, more important than the way we treat our body. But we don't know that only help na mere gị na ọkọkọ gị na ịwọla ancestor. The very moment you die now, I got that rie. Before you know it, actually can ancestors are whooping. Your body is the only reason you are a legal occupant of earth. If you lose your body, you will allow the gods. You have turned to the gods. So now, stroke can affect the man and the rules around him. Like I've explained this one, body weakness, working coordination. Some people, if you go your stroke, you find out that it will take longer. Their mind, attention. Sometimes I need chief attention, confidence, mood. Sometimes, or people very terrible mood swing. And not be like say the person we walk about because they imagine no go out breadwinner, but anything you say is law. All of a sudden, kitas now, your man, or maburo dogugi, maburo etiena po. Like they treat you like it's a problem, or it's a very big problem. So it could affect their confidence, affect their mood. And this thing now also has a way it affects sexual function. Big time affects sexual function. This is why some of the times with alcohol intake, before you need it becomes a problem. You get so work and productivity, your time away, career disruptions. For me, if somebody tells me, yes, avoid these things so that you live longer, at least in a time we may enjoy. I think it's something I would want consider. Right, your family dependent caregiver burden. I'll tell you, physiotherapy is so expensive. On about stabilize the children with a stroke, send there to physiotherapy. Or this year, can one buba this work? I don't know if you've had the pleasure of maybe meeting a physiotherapist gonna treat these things. You see, sometimes after seeing patients, or this year come more cable passes the ibuaro. And some of the times you do these things for like 6 months to 1 year, depending on the severity. And imagine if the person is paying like 35 to 40,000 for one session, 12 sessions in a month. You get so it calculates here, this one calculates this one. They say, you understand? And I'm not advocating complete withdrawal. Yes, I understand those things can be quite dicey. But then, if you speak to certain people, there are ways to help you completely detach from these things without feeling that withdrawal syndrome that come with it, right? Then loss of identity, it can challenge a lot of things, self-esteem and the rest of them. There's nobody that goes through stroke and come back the same way. Yeah, something would have broken in you. I'm going to time. You get so it's something we should consider. Is worth considering as well. So what can we do? First response can change the story, right? We've talked about be fast. Once I notice it, that's the first step, right? Now the second part is to act. Get urgent medical help. Please don't go to Enugu. I beg you. And it's not because I'm in the line of work. Frankly speaking, use your they introduce some of the times. Is similar drugs, but I say about one cup. But one shot. There was this lady that almost died in Amako then when I was still at Amako. I say about one shot of raw shot. That shot in here shot. So it was a cup whereby Ara Bachala that woman that day. Ana Adria, okay, kedu dose of ihe she cannot tell. Kedu head in that thing you drank. I mean, you cannot tell. Emari he mix. You don't know the state of how they mixed it. But they just told in and Dibo say go on hand the rest of that, you believed it. Do you know the number of people that died from ordinary malaria and Bebo? And then that's in Bebo, that's the herbs that they bring now and give you, and without knowing the dose. Hamaro mean previous history of stroke, they don't know if you have previous history of hypertension. Hamaro no one day na so they don't know whether you have other irritation, allergies, and the rest. I just say we're one shot, and that's just it. And that's why a lot of people are dying from this thing, right? So get urgent medical help. If you're in a hospital, first thing they will want to do is, like I told you, stop that bleeding, stop it so that the damage is no longer there. Then there are certain drugs they give you. The essence of that drug is to just mop and clean up those places in the brain that the blood has poured into. Mamanitol and the rest of them. Then after that thing, you now see, remember the last time the person was known well. Note the time okay, I'll just knock at a I'll just knock at a or one shot or where bido or not just get at or where that let them know, let somebody know all these things because all them get And you know the doctor okay, it was maybe drug toxicity, alcohol toxicity, it was high blood pressure and the rest of them. I say what exactly, it will become easier to help the person. Don't wait for the symptoms to disappear. Anytime stroke happens to somebody, I tell people the intention of stroke is to kill the person. I'm telling you. If it doesn't kill the person, half of their body becomes paralyzed. That's what people call partial stroke. But in the real sense of it, once stroke happens, half will go. So in Hana, where stroke is not partial. Do you understand? Even what we call partial stroke is transient ischemic attack. Or this stroke go about they come the person after 24 hours, so no residual symptoms. Or the transient or you get. But once stroke happens, half of the body will go. And the repeat stroke, or maybe a second time, is usually dangerous. It will kill the person because it shut down the entire system completely. In my practice, I know I've practiced for quite some time, or not so much, but then I have met a lot of patients. I have only 2 persons. Currently, one of them, Noba, I used to go and see, that I have ever met a stroke maybe 2 times. The other one was Ime Fig. Can meet the man. Stroke happened to him 2 times. Every other ones I have met died from stroke happening to them 2 times. You know, so we don't want it to happen a second time. Or once, let's assume that okay, that once we were not paying attention. Or any of your loved ones, let it be that you now go and start addressing it, right? So you follow through with rehabilitation, see a physiotherapist. And a lot of people that are parading themselves as physiotherapists, I say they are not getting they are not getting massage. Okay, let me continue next slide. I think I captured it. Massage is not what solves strokes. It's not. In fact, I don't want to go into it. But then, anyway, cascade of things. It might be simple activities, but then the mechanism required to help those people get better is a lot. You get because the person has lost sexual function, you go to get it. You get it. You get it. Brain you have to get it. Now maybe because okay, there is this patient I treated from stroke. Beautifully now, but Oga sign no signature, and that's why he's still in my care. So I now have to start teaching him to write again. That right hand there, I have to teach him to now use left hand to write and sign his signature for can the bank having a problem? You understand? So it is every of these things, small by small. Okay, make a tatil and watch out every single thing. And I tell you, it is time consuming, money consuming, stressful for everybody, including family members. So once we end this call, the first thing you have to do is to go and go BP, those are yard. Tell your parents, check their blood pressure. In fact, what I advise everybody, if you still have aged parents, buy head BPR. Do it this week. Go to your BPR. Tell them right name, date. There Monday 12th. A check a BP now to 120/80. A check in Abali. So that anything we can now tell, okay, this thing started last week. Oh, the values had been okay, consistent since last how many days? Or just Kabido. You understand? And every one of us should do it as well. It is going to help you. So next, then if you have somebody who had a stroke, right, while in the rehabilitation phase, because the problem is this, just like it took us for some of us now, it took us several years in nursery, pre-nursery, and primary school to learn how to write. If I lose how to write, you now have to start from the scratch. And that is why we must be patient with those people. And then you see the same way you see, because you know why I hold it like this, do it like this, do it like this. Till you teach that person to completely walk or completely use their arms, right? So you must encourage them, practice and protect them. And especially because, especially, okay, if it happens to you as a man, understand that our ego, self-esteem is on the line. You understand? So if you have fathers that this thing has happened to, let there be a part of you that understands what they are going through in terms of their self-esteem, their ego, and the rest of them. It was part of the things that happened that made me that when my dad had stroke, I had to start coming to work. I was treating him every single day. It took me 1 month and he became completely fine. God helped me get him completely fine. But that period, I forum because having to do something for somebody that on a inside, you understand, it it became a very big burden. You understand? So you must listen, protect these people, understand the peculiarities of what they are currently going through. You understand? So prevention is not fear, it's true worship, right? This is me wrapping up now. Know your blood pressure, move regularly, eat regularly, avoid those things that are not going to help you. Check and control those things that you need to check, right? If you don't have time to look after yourself, you will pay us to look after you, and it's going to be very expensive, right? So don't wait for stroke to become your wake up call. On about some people, oh, mgbe stroke mezi mommy ha ka check nke mommy check nke daddy. That is why I want to also thank the leadership of this house now for putting together a meeting like this. It's not everybody who chehana didn't ha. Most of the times on our focus, how do we make more money? KKC connect your business and the rest of them. But Imagon, they with little attention to the goose that is laying the golden egg. So it is beautiful as every one of you has stayed intently to listen to this little stuff that had been put together. Okay. So it's a wake up call, no act. If there are people you know now that and the rest of them, it might be a good call. Try somewhere around there, look for a physiotherapy. Say, okay, how can I help this person? And yeah, for some time. How can you understand? Because that's what I will also want to do in the next few minutes to see if I can take certain questions, right? From people ahead regarding maybe certain family members of yours that you know that had these challenges or challenges peculiar to this. Okay, so I choose to stop here. Thank you so much for having me, and good evening. Right.
All right. Thank you so much, sir. Thank you so much. This was educative. I'm again where some of us chọrọ ịjụ ajụ. So I think that there is a way you can raise your hand. So that ọ bụrụ na ị nwere ajụ ị ga-ajụ ka ị jụọ.
Na-enwekwa m ajụjụ.
No, go ahead. No, go ahead.
Okay. Good evening, everybody. Thank you, Dr. Kanu, for your teachings. Biko ajụjụ m mma jụọ ya n'Igbo ka o wee kwe onye ọbụla nghọta. Ị kwuru okwu nọ 8 minutes ka o were mmadụ iji wee brain mmadụ iji wee short or down. No, after 8 minutes onye anwụ. What if in a situation whereby hospital adịrọ nso mmadụ reach within the space of 8 minutes enwere any first aid measure enwere ike inye? Nke a wụ number 1 question. Then number 2 bụ enwere m an auntie, a younger sister to my dad. Stroke mee twice. O mee within the middle of last year or something like that. Or ya chaya eje Thanksgiving. Asị a na-aṅụ ọgwụ BP ya. After Thanksgiving, ọ kwụsị ọgwụ BP ya according to Yako. So within a short period of time, or gafere, let me say within 1 month or so, stroke mee nke bụ. And nke bụ o mee ọ ka na-aya today. Ọ na-ekwu okwu enwe ihe ya anụ. Like ka ya na-anụ. And o mee na one side ma aka na ụkwụ. Like ọ dịz active till now. So a question m bụrụ o nwere ihe a emenwu wee revive nwa ụdị onye. So yeah, with the 2 questions. Thank you.
Okay, thank you so much, sir. I want to see if I can take out that questions so that I will respond to them once. And when the other person wants a question, please just unmute and ask.
Yeah.
Okay, Afamaka John.
Yeah, I have a question. So, Doc, man, thank you so much. Kiss when our body here. I've never been in a session where I'm understanding so much. And it's so easy how you broke down everything. So thank you. So I have a question. This is me personally, right? Ever since we started this session, I myself have started taking my health seriously. So I work from home, and most times I sit down like pretty much, like 5 to 6 hours to 7 hours every day, and I noticed that has started like affecting my metabolism, and all whatnot. And then it wasn't like my physical activities increased, right? It's more like I walk and walk and walk, get tired, and I go sleep. I eat, and what any type of structure, But ever since we started this as a group, I've been kind of leaning towards like more healthy living. Um, Recently I did my blood work, and they said I have like the bad cholesterol you were talking about, the high one, and then the good one was actually low, you know. So kind of like wanting to ask, what are some of the other things I mean, I just signed up for gym like 2 weeks ago. So I've been going like 2 to 3 times a week just to make sure that, at least my heart is pumping. Um, I'm doing like very physical cardio activities that helps my heart to pump. So what are some other things that you suggest, especially some of the food and other things you might suggest I start doing to help reverse the high cholesterol?
Okay, and any other question? All right.
Okay, let me ask this. Let me ask this. Okay, like John Sueko, I think that was it last month or last 2 months? I stayed more at home because there were projects I was working on, and I was trying to equally get insight into AI, so I can sit for hours. Sometimes I go to my bedroom around 12 or 1, and then in June, August, and then when high blood pressure. That was one of the times I went at Atlanta with my wife, and so I'm like, how? So the doctor asked me follow up from okay, that I should even quit from work for at least 2 months to to be able to reduce it. That time I was like, my wife will 2 months is the time my wife will give birth. I'm quit here from all. Are you the one that will pay the hospital bills and all that? So, but I think I have to start sleeping well. But then my question is, there are times I don't go to the site, like John Sweko, and we ain't gonna no, like okay, I'm something that I can be doing at home that can probably help me. It's open apple because there's times many members of time I don't have time for apple. What can we be doing at home that can help? I make quite sure na anyway, enough activities in the body and reduce probably the high blood pressure or something that the doctors talked about, and also reduce the risk of image stroke, because according to Ifi now, it might happen to any of us, and it might also happen to anyone check on all the safe at on and on, so open something you guys suggest I'm na side some of us now call no, and when then alcohol no office and they stay there for like hours, so probably you can help us.
Okay, okay. I want to share my screen. I will show you put something. All right. I really want to help you guys. Make I show you something that change. In my own way, knowledge makes it difficult for you, especially it makes it easier for you to accept a life of discipline. In my Bible verse that comes to my mind is you see that thing that happened with Isaka. When he see for na urugadini ha same back in you be where man. And that's the same way when he see for no home dini in your be whatever is gonna cost I will handle this thing. I'll show you something. Let me see if I can share the screen again. Okay. Only Hannah, what sitting maintenance currently going on now is sitting disorder because Mr. John raised it up and it's a very big issue currently, even in the US and amongst sedentary workers, people that work from home. I want you to read this thing with me. Sitting disease by the numbers. He said, if you sit, okay, but let me use this one. Sitting increases the risk of death up to 40%. He said sitting 6 hours per day makes you up to 40% likelier to die within 15 years than somebody who sits less than 3. Even if you exercise. I can research now. So if you see somebody that sits 5 to 6 hours every day, and this thing now, majority of us may as well here or may on 9 to 5. We have this sitting maintenance currently going on, and that's why MA will be saying no. No. Why is it that our youths of nowadays are dying young? This is it. Once you sit, you're a driver, long distance driver, on in Azwahia shade, and then you sit down in office, no more boy, and now I gotta go there and the rest of them every day. Once you sit 6 hours every single day at a stretch, your chances of dying goes up by 40%. That's the statistics. See this one now. It says female that sat for over 6 hours a day with sedentary lifestyle, 90% more likely to die. This is 2010 study. Males who sat for over 6 hours in comparison to active workers, 40% more likely to die. Then he now said the amount of exercise had no effect on the harm that sitting was causing. The only way to reverse the sitting problem is to stand and move more, which is the advice I'm going to give everybody. So we came up with a system, and that system, if you look at most of the remote workers, especially in the US and the rest of them, what they started doing is that they get all this type of adjustable desk that they can raise up to their standing height. So even most office workspace, especially in tech hubs now, when we design workspace for them, we make provisions for those adjustable desks so that you can raise it up and then stand. Because what happens when you are sitting is that your entire metabolic rate will start dropping. The calf muscle, in fact, there are a lot of cascade of things that happens. And if you sustain it for 6 hours every single day, let's assume, okay, you drive to work an hour and then you sit at work, maybe say from 9 a.m. to like 2, 3, and then you now maybe sit again, especially for those who day Lagos. By the time you know it, total hours spent in just sitting is like maybe 8 to 9 hours. You now find out that some of these things, no matter how you try to work out, to go to gym 2 times, 3 times a week, is not going to combat the effects of the sit. If you don't, first of all, make adjustments to the sitting. You understand? I am pointing it out to see if I can answer those questions, especially on those that already started checking up on their health and finding out some of the things they need to work on. The first thing you have to do is make adjustments to the sitting. You get? Now, how do we do it? Now, this is the advice we give to people. Do not sit for more than 30 minutes straight. If you're able to do this, it will help you. In fact, even man at church, after every 30 minutes, I will stand up. I pump my legs. Up. Then I go and sit back down. 30 minutes. If I have to sit for 6 hours, 2 to 3 minutes break for every 30 minutes. That is why anytime I teach people physically, within 30 minutes to 45 minutes, we'll stand up and do a little exercise. twist, turn, stand, bada Kanu. Something as small and random as that will have blood pumping up faster and more efficient than ọ bụrụ na isi okay ka ị nọchagodi zocha mecha ihe then tomorrow isizie ka ị gaa gym. You understand? And if you try this thing out, you will find out that it will make it easier for most of this your physical exercise and the rest of them to produce results. Okay, so you will now see that okay, the little exercise you now do, if you devote maybe an hour, 30 minutes in the morning, you will find out that you now start seeing results come out. Another advice I will give to every one of you, if you can afford it, convert your house to a mini gym. Reason. It will be difficult for you every day to come out and drive to the gym. Sweat, especially if the nature of your job will not allow it. Imagine if I'm not going out this week. Gym no maka gym wepo outside. It will be a bit difficult for me. You get, but if you get something as small as a treadmill, those are your palo, and then set an alarm for it when you wake up after you've done your morning devotion and the rest of them. Just walking on the treadmill. You can even be on the treadmill for those of us that work from home. You can be on the treadmill, attending to some of the messages and just keep working on it, working on it. By the time you're done with it, you continue the rest of your day. Sometime later in the afternoon, or go. There are other ones, the bicycle, a meet and cardiac bicycle. You can sit on it and attend to one or two things. And it being at home, you encourage your spouses, your children to pay attention to it. You understand? It is able. You can maybe get a multi-gym, all those other things, and a teacher at gym. But you see these two important ones, very, very important. If you can afford a treadmill, please put a treadmill. And when manual ones, where electric powered. If you cannot afford the electric powered one, you can get the manual one. But when you put something like that at home, like that, you see that it's going to help you solve some of these problems. I don't know if I've been able to address those questions. And then secondly, the question regarding first aid for people having stroke. The thing is, because you might not really know what exactly is causing the stroke, it will be difficult to administer a proper first aid. Usually, what we give patients stroke like this, sometimes they give them aspirin depending on what exactly the patient is presenting with. Because some of them, if they present and then you give them aspirin, before you know it, BP piano, or if you give them antihypertensives, but it's a combination of all BP and some other things that helps to bring down that blood pressure. But then that is if you know that blood pressure is the reason the stroke is GMS. That is why, and it takes a level of expertise to be able to properly ascertain this thing and administer effectively. That is why the best form of advice, the best form of counsel, the good counsel concerning management of stroke is to simply look for the nearest hospital facility. Usually, the hospital facility is a primary healthcare center. Let's assume not just one nurse or two nurses nearby. If they give the patient normal saline, let's assume they give that sugar water. What the sugar water will do is it will increase the volume of water in the body. Also, increase the volume of water in the body. Also, clot, or maybe a blockage, or a blockage. Increasing water will help open blood flow in water so that blood will be plenty that will now go to the brain. It will help in a way. Also, hypertension, increasing the water content in the body can now start making the body now start saying, okay, go there, and the rest of them. So those are usually things that can help in the beginning. I had to be sure what exactly we are dealing with. You understand? So referring the person immediately will be one of the very first. It's one of the best ways to help the person. Then the question regarding his auntie, the person that asked regarding the auntie having a repeat stroke. Like I told you, a repeat stroke is very difficult. I know God has helped me in my practice. That man that I met, that was the only person I have record of that had a repeat stroke. God helped us to manage where to wear small. And then now this other one currently I am managing, but I started managing him. I started managing him last week. I think last week Tuesday. So today, one of my staff called me to tell me that the one Kuba go out. But there are certain factors that made this thing possible. One of them is the grace of God. The second one is that this person bumuke. Sorry, the mic turned on. Okay, yes. The second reason is that the man is now okay. And with men, on it easier for them to want to do whatever it would cost to get better, whatever it would take to get better. So for your auntie, if she has been seeing a physiotherapist since that time this thing started, again we go some level of changes. It will not be as it used to be before. Even though that the healing and recovery rate will be very, very slow. But it is something that physiotherapy will be able to help her live better life than she would without physiotherapy. In fact, if the auntie is not seeing a physiotherapist, she will die a vegetable. This is not, no offense, no shades, but that's what's going to happen because the function will just keep dropping before we come on one. Before you know it, next month you come, I say, that before you know it, I say, that because the nature of activity that is required to reverse that thing, most of the times will be painful. And the only person gaming with that thing is somebody that is trained. So that only a big that all the things that you're supposed to do. So that limb will recover. Does it used to recover? Yes. But then it has to be somebody with the expertise required to help her. So about that for a physiotherapist, please have her see a physiotherapist. You can literally walk in, sitting at your physiotherapy department, and they take you there and you take your auntie to that place. That the only problem now, Bukari Imagun pricing, but at least God can help you. Chotapanone, what a fear of God now pricing. But you see that when you start physiotherapy, the auntie and her caregiver, and they not make their own, you will find out that she will be able to make remarkable recovery on the long run. I've met patients that 5 years ago had a stroke and it was poorly managed. And God helped us to recover at least. If before I couldn't do this, but now I can do it. Before I couldn't stand up, now I can stand to walk. Even though Norman this as smooth and seamless as it would have been if it was just once. But then it will be way better than the alternative of Ibiari. So I don't know if I've been able to address that question. Thank you.
Now, Doc, thank you. Before I wanted to ask,
Biko iwe ga-adị n'ọkụ dọk. Ihe m chọrọ ịghọta na in this case wụ as onye nwego na stroke ọsọ physiotherapist bụ ihe ya reverse nwe ka onwe medical treatment a na-enye coupled with physiotherapist.
Now, the thing is this, when it comes to the function, let's assume naka ademeyareze, ukwu ademeyareze, akpere ade, those things will function. Only Mundi when the skill required to help her. But let's now assume that in combination with that one, like now you talked about speech disorder, like Ode Kuchan would do work for my and we're a group inside that rehabilitation framework and about speech therapists. On how and the na speech. So those ones will now also have to be contracted again. Okay, we can in the speech. But then when it now comes to movement, function, or physiotherapy alone, but then physiotherapy will not come and act alone because ihe a na-emegharị aka na-emegharị ụkwụ ọ bụ na onye a nọrọ on antihypertensive ọ bụ na onye a nọrọ on ọgwụ ga-break clots and the rest of them ị ga-afụ na nwike obigharị aka ya o dislodge or something nọvụ n'ime akwara or ga suture the brain again. That's why if you go to physiotherapists ndị ma ihe a na-eme they will ask you kedu ọgwụ onye a nọ on kedu doctor na-afịa so that they will be sure that onye a now is taking treatments already so that those things how I get amazing now will not counter or will not now become contraindication. Or maybe heading at the so it's the combination of that thing that will be able to help the person.
Can you guys hear me?
Okay.
Can you guys hear me?
Yes, we can hear you, John.
Oh, okay. So, Doctor, earlier on today, I had a conversation in our group about alcohol. Do you mind throwing more light on alcohol, especially beer? Right? throw more light on beer and how it affects our health.
John, ebiakwa. My brother, tutu unit na 1 unit I can
Mama,
Not only, not only beer alone. What
Mm-hmm.
about spirit? Not only Okay. beer alone. Okay. I want every one of us to go and research. In this age, if you go online to internet, you will find anything that you're looking for. Albany and Troy back up your claim that beer is good. A guy internet, for somebody must have written something about it. But if you want to objectively find out whether or not alcohol on its own is good for the body. Now, I'm not talking about wine. Even some people will even tell you take wine, don't take beer. Beer is worse. I want every one of us. Maybe when we are done, I will send it through ARC. I will send an article on that latest study Emego on the effect of alcohol, and it was a study that combined both different types of alcohol, rum, Fanta, and their effects, short-term effect, long-term effect. I posted something similar to that on my WhatsApp status, taking alcohol for few weeks, few months, what it does to various parts of the body. I will also forward it to ARC. What it does to the liver, what it does to the stomach, what it even does to the brain, what it does to the penis. It has effect on all of them. And I'm not talking of heavy drinking. I'm saying mild to moderate drinking, see the effect. Then heavy drinking, see the effects. You will now find out that on any of them you will prefer. On any of them you will prefer, I assure you. Because scientists has proven that no amount of alcohol is good for the system. No amount of it is good for the system. One, it does not add anything to your body. Aside from the high and the feeling you have, there is no physiological benefit. And the truth with the body is this. The body does not forget. And it does not forget. So you see somebody come on like maybe 60 years. Now you're something now. Enjoy it on alcohol. But then when you now probe deeper, if on bottle had a gaffy and one on okorobia. Like bottle no fee pass. If he pass, he must empty. Come on, God done a crate. But now he has stopped drinking. And he now thinks that, when last came was 2 years ago, and he now feels like the effect of all those years of drinking will just disappear like that. No, it won't. So anybody that wants to really know about this, and you want to objectively, because the truth is, you know these things. The only thing is that we are just looking for I heard only na everybody here. So we're just looking for something or somebody that will just say, I want to. The truth is, no amount of it is good for you. They know it. And they are now the people that do those things, they know it. And that's why even a lot of them say, you'll be surprised they don't take it. You'll be surprised they don't take it. So I was able to say I don't puzeria. They now dump you with you're now telling others or convincing others why this one is way better. Is brewed. Yes, it's brewed properly. But what exactly is the physiological effect when it comes in contact with your liver? What it does to, because for every single alcohol you take, your body must burn it away. Your liver must detoxify it. You must completely remove all the toxins. That alcohol itself is a toxin. That's why certain levels of alcohol are used in bleach. Certain levels of it are used in chemicals. That ethanol, 98% ethanol that is used in manufacture of certain chemicals, dye, bleach, and the rest of them, it has a corroding effect. So water it down to the percentage, 5%, 4%, and the rest of them. It is that same corroding effect in all those parts of your body, from the lining of your mouth, to your stomach. The liver now has to work twice as hard together with the kidney to start breaking it down and sending it away from the body. So I am putting my liver and kidneys on jeopardy just for the feel of there is no medical benefit to alcohol. There is no physiological benefit to alcohol. You understand? And I'm not saying this thing because I'm a Christian. I'm saying it because I'm a scientist. The same thing like pepper. Pepper does not have medicinal benefits. It does not have. We just put it inside food called you understand? So if I come out tomorrow and now find out that pepper has one or two effects that it is doing to my body and that is negative effects, on the basis that it's not adding anything to start with, I can readily say, nah, I'm done with this thing. I don't know if I made some sense. I don't know if I shook some tables, but how do you call guys?
Dr. Dalo.
Doc.
Hello,
Doc,
sir.
Doc, biko, good evening. Biko, ọnwụ ya ajụjụ m chọrọ ịjụ ụmụnne m ekenekwa m nkịta ka m si ọrụ abata ma nke kwuligbu ya. Doc, biko ihe a na-akpọ stroke a na-ese ndị maka mma anụba mba ọ bụla ihe amụ biko nu a na-asị na akụrụ ya stroke emeli ya stroke datin ikwete na datin.
Ịma ọ bụ na ịbịavu n'izizi anyị
Onye ka nsị kịta ka m na-abata ọrụ isoro m biko nu na achọrọ m ịkpọchi ya kwa gị bak biko asị gị na vileji akụọ gị stroke.
ọgọngụ a ka apụtara chen ka ndị wenye aka kwuo okwu na
So I believe in ihe spiritual. As a matter of fact, I believe that the spiritual now control physical.
Yeah.
But more than that, I mentioned something. As in if they want to send stroke to somebody, first thing they will want to do is to communicate it in form of information. That is why for anybody has now stroke without those people now could stroke on a phone. See na nwere kesi submit afa gị ji bịa na nke anyị na ọkwa maka na afọ m afa gị wee ndị mmụọ wee gwa m n'ike ibu ezigbo mmadụ and then wee sị ka m kpọọ gị na phone. That's why, because on a normal nchekụ gị stroke, why do I need to tell you na nna akụ gị stroke? Ọ itete one day ọ bụrụ na aka gị ada arụ ọrụ, but go and check everybody nọkọta mmadụ asị ya na mma akụ gị stroke. They tell them on the phone. Why? Because they want to engage a physiological response in that person's body. And that physiological response is this. The very moment I get that thing, there will become a spike in your blood pressure. Blood pressure again. And hang. Or saying 7 days. Do you know what will happen within that 7 days? BP will be from 120 tata. 6 more days on 130. 5 more days on 1/4. Anytime mmadụ gwa gị anything about 6 days, 7 days, bam, otie gị n'obi. You now find out that before that 7th day, upon you've not gone to go and settle with the man. You wake up on that 7th day. Why? Because one, there are two reasons to this. It is believed, even scientifically, that the thought life is the real life. If you have a Bible, as a man thinketh in his heart, so he is. If I think I'm sick, I'm sick. If I think na mmadụ come stroke. As a man thinketh in his heart, onako gesi play out to him. So once they mess with that psychology, you now find out that the next thing you start seeing is that you start placing a demand on your body to produce those symptoms. All of a sudden, you got ChatGPT as again, heart palpitation, weakness upon this thing. As again, so normal weakness that would have happened from stress from the day. But the fact no within that 7 days, it will be big or the big go. And before you know it, those presentations become your manifestation. The next thing you got frozen now, still can't be. But now you see that because I've had people that come out. There was one of these days I was talking about this same incident that happened at the office, and somebody came out and said, "Nah, put on a phone or back a child person." They said, "No, I'm the babu there." Until today, he's still alive. Or one of church or one of prayers he did especially. What did he do? He defeated that fear. As he defeated that fear, that thing did not rest inside of him. And that's why if I control my blood pressure, control my sugar, control diabetes, or what anybody got stroke. If they want to do it, they will have to first of all make one of all these parameters get so high in your body. Urban or draw high in your body, go and take it. Nobody will be able to do it for you. And this is the physiological part to it. On whether anybody that has ever had a stroke, if you check, it was not blood pressure or it wasn't sugar, it wasn't diabetes. I'm telling you, here and now, study that has sparked. There was this study I participated in my undergraduate year. It was framing hand study. All the study we used to design a check risk factor for stroke. It was a 14-year study. For 14 years, they were studying the pattern of everybody that's ever had stroke in Africa and several other countries. And this pattern was consistent among all of them. Majority of them, it was high BP. Others, it was cholesterol and diabetes. Some others, it was salt and high blood pressure. Some of them, it will now be high blood pressure and no physical activity. Maybe around 9 to 5, so they don't do physical activity. So once BP bonite, that was what caused the stroke. If you check with some of our parents, it was when they retired that stroke happened. It didn't happen in Bonabo, poor housing, see housing way back again, and the rest of it. It didn't happen there. For some of them, okay, chiche. And that okay, chiche is high blood pressure. You understand? So yes, I believe the spiritual aspect to these things. But then understand that if I do the physical aspect and clean the physical aspects, chances of the spiritual aspect affecting me is not going to happen. And that's why some of these people, higher that stroke that they tell you they sent, if you don't come and recondition their mind, they will never believe they will ever get better until they go to that dibia. So that's just it. Even that man that they told 7 days, he should go. I brought him past, but he should go. Nothing will happen to him. I feel a line every single day and see it didn't happen to him again. But that period, it would have happened to him because that day of their office, if we be BP working mad enough, and see, what's the difference between go and a stroke? Also, not die have BP before until I wear. And that's how the game. That's the game they play. You understand? So yes, understand, but then understand this is how I feel it happens. You understand? So that's just it.
Something.
Thank you.
I want to say something.
Hang on,
Doctor.
Biko, hang on. Let's follow the line. One fair, go
Yeah,
ahead.
I want to.
Then Konya
Okay.
bu iPhone. Obo ni ijugo aju Biko wait to Akage. One fair, go ahead. Then after that, Nzube will come
Okay,
to you,
doctor.
okay, Biko.
Doctor, can you hear me?
Yeah, I did with you, sir.
Okay, thank you for enlightening also. I mean, I learned a lot in the, but then achọrọ m ka m malụ the place of good dietary intake in reducing of high blood pressure, which you have talked about is the main cause of this stroke. Because over time, I strongly believe now, only if I legacy that spike in the blood pressure in us. So I have wanted to talk about that aspect during the course of our discussion. Some of the food and diets we do take that spike up our blood pressure that can lead to this stroke. Because when we are conversant with this now, okay, like ultra processed foods and all what, I think avoid this deadly disease. That's my own book. Then secondly, some stroke severely. When it happens, if you are not out of the world, one, will that person be ever reversed? Then what is the possible cause of this? Or the severe. Severity if you is almost out of the world. Before you know it, the person will now
die.
Will not die. Yes. So I just want to know what actually is the cause. Then enwelo hope of reversing it even to some extent. So that's my humble wisdom. Thank you.
Very powerful questions. Thank you. Yes. For those type of stroke, part of the things that make a stroke deadly is one, which part of the brain come and affect? Which part of the brain was affected when the blood flow was cut short? Let's assume that thing happened, and the part of the brain that was affected, was the right part of the brain. I bet at the right part of the brain now. The right part of the brain, they're responsible for fine motor movements, imagination, drawing, and the rest of them. So people with that type of stroke would most likely something like we can say has a cup. You will find out that cup how we can take a bowel or some other things, fine motor movements will be affected. But then, men at the left side of the brain can the center for speech and hearing the near. So anybody from now that had stroke on the right side of the body, most likely ever they affected by the left side of the brain. And most of those people, if care is not taken, it will affect their speech. Anytime I come and see stroke for right side of the body affected, it can afford because I already know the chances only now getting a problem with speech and hearing, no, on that left side of the brain. So you now see that already only the right side of the brain they affected is has way more chances of recovery than the other one. Now, although the type of stroke that happened was as a result of blockage. Ịma, ọ bụ na pipe na-agba but ọ da agbasi ike, at least mmiri a na-apụtakwana ya, some things fluid a na-eflow, so the extent of damage to the brain agaghị adị much as against ọ bụ na mgbapụ ka ọ gbapụ. You get that mgbapụ that, remember that I said ọ gbapụ n'ara, what will happen is that the blood now that is going into the brain ga-awụsasị in some parts, and that part all will start decaying and dying. Then there is another part that the blood should have gone to that it does not go to. That part will be no more. So you see that hemorrhagic type of stroke now ga-adị way more severe. So now imagine a hemorrhagic type of stroke nke mgbapụ that now happened on the left side of the brain. You now see that double combo. So for those kind of patients, you now see that I think only have stroke, but stroke they bad or they very, very bad. Now, which leads me to the next part of your question. Can it be addressed? Yes. Yes. And we go a lot of advancement in technology that makes those people hit the hospital early. They can make tremendous recovery within the first 3 to 6 months. Once they start physiotherapy, start moving, because this is why physiotherapy is important. This is what I wanted to tell you people. Thank you for this question. Emma, so that it doesn't look like I'm just preaching hengoro. This is why physiotherapy is important. And not just physiotherapy. Any physiotherapy is better, or the only thing on a mega or your caregiver will massage. That person is in error. Because this is what happens with the brain. The brain, by pattern recognition and repetition of activity, the brain learns to gain mastery. So, for example, I don't know if you've seen people skilled in maybe playing an instrument or certain things. It was, first of all, repetition that led them to mastery. So, every part of my body is discrete in its function as a result of mastery that the brain has obtained. Now, if I lose mastery, I must go back to start repetition again with the intention of gaining mastery. So what he means is that although on my right hand be responsible for iweni up and down and side, if I want that part of the body to start that function again, I must start repeating that movement up, down, and side, those movements that are lost. And I have to repeat it long enough for the brain to now take it as a movement pattern that it should adopt. Again, is a mastery. So we are using that part of the body long enough. For example, within this call I may go now, everybody nearby now must have moved maybe Isiakia close to maybe 200 to 300 times. That's your fingers. So imagine if I now lose function to this finger for a week. You now find out that when I want to regain that function, I will now have to start using that fingers of mine as often as I would have been using it before. And that is the way the brain gets where take is that movement. Go badozie where says okay, let me start doing this movement. So it's like teaching the brain that repetition. And that is why the only thing that does that thing is exercise. So what we use actually to treat and manage stroke, mono or but completely exercise. Massage bụ just ụmụ ike ọ bụ na onye pain dị ebe a na-arụ ya imegoro emetụcha ya so that onye feel warm. But it's punk exercise back to back, and it must be repeated so often that it now starts making the brain and master that movement. And this is the part a lot of people don't understand. So abịazie physiotherapy, okay, and I bet 3 times in a week because imagine number of people patients carry. So I met tata. I'm amazing again until next tomorrow. You now find out that the brain will only recognize that movement as a movement that happens alternate day. So only that period, and only that period the physiotherapist got there about 1 hour. So 1 hour alternate days, that's what the brain will be understanding. But so what it will mean is that that person will not recover as much as somebody that is now teaching the brain to repeat that movement every 2 minutes, every 2 hours. This was one of the things because in my now and what they practice, it was with my dad's condition. Kanjima is real. Because I had to every single day. I did exercise, stimulated him, repeated the movement on a phone. May insist that my mother does the same thing. I repeat it again 3 times every single day for a month. Do you understand? And that is why even in my practice, I don't go around deceiving people. I tell them, okay, for this 3 times a week, okay. So I will teach you something on those days. So that when you do those ones on those days, we do the days on that repetitions. We get made the brain or masters here. And this is one of the ways to produce results for every type of condition, whether more left or more right or whether more came how many years. The only problem, Gabo, if it had been maybe say 5 years now since they repeated the movement, you now find out that you're already against 5 years of disuse. So on so maybe their expectation might be so high. But overall for getting the brain to go and remap it, cortical remapping. Others they came, but I know now. For now, a lot of things, plumbing work, and can need in a mess, and can maybe it got rewire the place. You remap it on your cortical remapping, brain remapping. I remap all the brain aware those you take those functions that had previously been lost. And that's how those people are able to recover. I don't know if it addressed your question.
Yeah, Doc, it looks like I get bring it back for 2.0 because this section has been so good. So we have like more like 15 minutes. I don't know how many questions you still want to take. And Austin, I think we have another exercise after the question and answer. How do you want to do this? Should we go ahead with the questions or?
Okay. Let the people that have questions ask so that I'll just write them down.
Doc, you have not addressed that of good dietary intake I've said before now.
Yes, so yeah, okay,
Yes,
I'll take it down. Okay. Any other question?
Nzube, please go ahead.
Okay, Doc. Good evening, Doc. Good evening, everyone. My question is basically on alcohol because yes, I really like your explanation on alcohol. But one thing I wanted to ask is because some of these food intake that we do take, carbohydrates, when it goes into the stomach, it still boils down. When the digestion takes place, you still find out that the end point will still be alcohol. That's why whenever madobole organize or ferment go imago that kind of thing.
All right. Yes.
I'm coming. Alcohol and fermentation. When a yeast is sugar, it ferments. Do you understand?
Yes,
Why I'm asking, you are saying, okay, we should desist from alcohol. Because I've gone to some of these classes, and somebody asks, is it that they will not, some of the things that they are eating, they will stop eating it because it still boils down to alcohol. Because why I'm saying beer is more okay is the beer is brewed, then the person now on care will say, okay, even if you must take, don't take all this sachet or something like that. Take something that is being brewed. Because this harmony in alcohol had go too much. So I really want to know if or same was pam pam pam. Let us know. Do you understand? Because when you're madly now, now may lead to one thing or the other. Thank you.
All right. Any other question?
Anye, Timothy, go ahead.
Hello, doctor.
No. Hang on, please. Timothy, Anye, please go ahead.
Okay.
Yeah, good evening. Doc, good evening. Can you hear me?
Yes, I can. I can, sir.
Thank you so much for the lecture so far. I better early, but I have this question to ask because I've heard it from one or two persons way back that if you have a diabetic patient, that most of their drugs spike this high blood pressure. I don't know how true that is because my mom, she's a diabetic patient, but for some time we noticed that her BP started becoming high for some days now, and which she went to the hospital. They had to remove some of the drugs she takes, and she was asked to manage her diet more than taking those diabetic drugs. So I would want you to throw more light on this drug of a thing. Thank you.
Okay.
Pampas.
Name my ajụjụ.
Yeah, I know, Pampas. Timothy, you can bring down your hand. Yeah, Pampas. Okay, Pampas had you already. Onyebuchi, go ahead.
John. Hello?
Yeah, Pampas, go ahead.
Yeah, good evening, everyone. Doc,
Yes, sir.
yeah. Doc, because I'm Joe, as a BP patient, na-achọrọ ịdị na-anwụ ọgwụ based on na a na-asị na-atụ egwu ọgwụ, as in, because my mom, she died kidney be able my mom, and I've known my mom for 30 years now on her take medications for BP. So Majuba's okay because other mmanya and other things. So Ajuba's as no all one basara the BP strike the kidney whatever. So more no BP, and for one day it take away BP medication. Yeah, nemebo. I'm not stressed, if you not stressed, Jesuit or something. Then beer, my intake of alcohol, now beer mostly a year on a year off for 10 years now. You understand? A year on, a year off right now. So because when you go on drug, yeah, the effect it's a matter I take drugs about BP, not the bad,
Yes.
Yes, Malaria. Mm-hmm.
Okay. Onyebuchi, final question.
All right. Doc, no onye ọbụla ekenekwa m unu. It's been a wonderful presentation. Ịghọtaga join bụ m so mechapụ bịa join kwa ọzọ. And although na mgbe m teta, ịghọtago, I realized that I was about 30 minutes late. Ịghọtago. So ihe mwaghachi ịjụ bụ na enwe ihe ọ abụ mee mmadụ then ị bịa ghọta life na spirituality. Ịghọtago. And mmadụ onwe m amụ atụ based on ihe mmụọ afụgo ịghọta. So abịa m na-afụ dọkịta ịghọtago. So nwe ajụjụ ọgwụjụ m anya. So asị m na ihe a na-eme m n'ọdịbụ na ọ na-eme na ebe mmụọ si wee pụta ịghọtaga, n'igwe okwu maka stroke. So na be m afụbeghị m onye nwere stroke ịghọtago. So mụ a na-ajụ one ihe a na-akpọ stroke na ọ na-abịa na agbụrụ? That is my first question. Onwe ihe ya bụ mebi ọwụ na mpampa onye anwa nwebu stroke ịghọtago, na enwe likelihood of that need repeat na the agbụrụ. Nke a the first question. Then another one bụ na more believe na natural means or ways of treating a patient than ụmụ ihe medications a. And they watch ya ka Pampas wee kwu as na ọgwụ medication ọ na-eteki nne ya na-eteki wee mela affect that kidney ịghọtago. So and mụ afụgo ihe these medications, some of them ka esi manufacture ha. Yotago, but I believe that now, with some natural herbs, that's my belief for Yotago. And more key is we suggest, yeah, Yotago come na do ganyo, maybe more na to them leafy vegetables, Yotago, onwe na kwụsị ihe ọwụna any symptoms of stroke, because I believe that now some of us not here who something about pressures of life. And the more I believe can environment one of find we lead the onyanwa to some it develop all these sicknesses. They give we kuna models no or ya come model stroke. So which is pretty much common. Now so my two questions in summary one ihe a na-akpọ stroke ọ na-abịa n'agbụrụ, that is one, and the two, enwe more natural ways a na-eji reduce the ihe na impact of stroke in a patient's life. Audience can draw.
Yeah, Buchi, thank you very much. So I get close this equation from here.
Mr. John.
I ain't where
Hello,
the time.
Mr. John.
I ain't where the time.
Don't see him chief they take most time. It's just like not like a question, just like an advice, okay?
So hang on. I can wear some people that are ahead. I ain't where the time. We will come back. We'll bring Doc again, please. Because
no, it's just like because almost something over that I want just to correct on. It's just an impression that I want to correct on. Okay,
hang on. Let's not waste time, please. Doctor, please go ahead.
All right. Categorically from the last person, Jojo. Audio my stroke at the hereditary on Abenabo. Yes. Emma, those risk factors of stroke, we talked of hypertension, then diabetes, na cholesterol. Boni easy from a family that your people are on the big side, plus size. You got already. Even with the small cholesterol level are the high. Some of them, even young girls, if you blood pressure they go high already without doing anything, even at 12, 13 years. So yes, on Abia, you get. That's why also the previous history of stroke, cholesterol, and diabetes in the family, but non-modifiable risk factor. Because when he gave but now when you have those non-modifiable risk factors in your family, now peak is you those modifiable risk factors where court fall down on them. It was a problem for you. And where this family friend so it happened that na Boroha, his own father's side, from in fact at 40 years, so he broke it because he got married to a pharmacist. And the Imagon, he is in his 70s now. So it happened that his brother's son clock of 40 and died recently. He had never were March. So the village people now gathered now saying, I had to marry this guy. Can every now and then, man, 40 years. So they now started making questions and even prompted them to come to this man's house. So when he told me the story, I started asking him, okay, Daddy, kedo ndi Bruno is because he had a stroke. And I started asking, oh dear. I now found out that his entire family lineage, as far as we know it, have been hypertensive. Even his younger children now, his son, on the plus size. And he check his BP, he check his cholesterol there. So you now see that thing had to go in the gene already. They need a stroke for him to die. The only thing at 30 something to 40 years, once that fear of 40 comes in, or Brunezi BP, or Buze final breaker, a park is here. So yes, if this is why everybody needs to go out and check. Go your mother for certain conditions. check it very well. Your sister can wear those conditions. For example, Obona, your mother found it difficult to take in and give birth to you. Ogadina, your sister's gene, or something she has to start addressing on time. Obona, your father now had, or your mother had arthritis. Arthritis, no, yeah, ABRA for arthritis. Chances are, you check it very well. Either you or your daughter would have that gene inside of them. So all they go engage is that now we decide in this house, no more this, no more that. No more I get bidon can no can jogging book compulsory and can the rest of them. He tweak is those modifiable risk factors. And we borrow those ones also. Now, which leads me to the next question, Audrey, about natural herbs and remedies. Now, this is the thing. I don't doubt the efficacy of natural herbs. I don't. The only thing I doubt are the dosimetry. Case where and where there studies and where there research that can now quickly tell you that this drug, because the thing is this, one we can now go pain, kidney. Imagine one drug on our going hand, but then the level of cytotoxicity in that drug will be such that it will weigh down on the kidney and liver. That's why I pay for abo sellers. Abo sellers are literally hawking death. You know, abo see one man that say mix serum infection, mix serum mix it. They are hawking deck. It's not as if those things don't work. But the reason or carry is that there had been layers of research that backs up ndị kwesịrị ịnwe ọgwụ, ndị na-ekwesịrị ịnwe ọgwụ. And that is what your doctors gara school reject go. So apụta now before enye gị ọgwụ ajụọ gị ị na-enwe nka ị na-enwe nke a ndị bụ na-enwe nka ajụtacha gị dị sure na this particular one a ga-eme gafe before enye gị ya. So yes, ọgwụ BP nwere ike ọ bụrụ na it cost that onye nke kwuru okwu sị na ọ cost his mother's death, but that thing prolonged your mother's life longer than she would have lived on a normal if she relied on natural herb or she didn't take anything at all. That's just the truth. You know that. So yes, I can advances in these things, and science can go back here. For example, all pain, we tell people you can't live on all pain, all mega affect the kidney and liver. You can't live on this drug, all mega affect. We know that the effect, and that is why everybody are now okay, how do we get out of the long-term effect of taking these medications? Okay, which is part of the last things I will want to address before I wrap it up. Then Oyinke Joro Ajojo. Okay, yes, taking blood pressure meds, that's the last one I want to address. Then insulin, that asked the question about diabetes leading to blood pressure. Now, directly, they might not directly raise the blood pressure, but there's something that most of all these diabetes drugs do, because sugar can go in the body. So they want to dilute the amount of sugar in the body. Most of these drugs will increase the amount of fluid they are available in the body. Other they can eat in MT now. MT with small water, or got the thick and the sugar level got the high. Or got the too much that once you take it or the too sugary. Water. But some people will now come out and pour more water on it and then now take it inside. Don't go for sugar cake and with chakwa in the end. But it gives you an idea as to something. If I put more water in that thing, then the taste of the sugar, like the volume of the sugar per packed portion of it, that is lesser. And that's what insulin does. So in a bid to reduce the sugar, random free flowing sugar in the body, it will increase the amount of fluid inside the body. And increasing in that amount of fluid in the body is increasing the blood pressure somehow, inadvertently. So it is not directly raising it up, but in a bid for it to do the work of a cerebral, you will now find out that all of a sudden, BP, and that is why I said earlier that some of the times between those three issues, cholesterol level will cause hypertension indirectly. Sugar level, if that's raw sugar for some time before you know BP, all that mechanism of action be here. That's why sometimes Dr. Winke will place you on mild antihypertensive water. Then place it, and that antihypertensive gabo one that will be allowing water to be now the person water. So while insulin is doing the job of increasing the volume, the antihypertensive, and now I know possess the fluid immediately. So the combination now is what the doctor, depending on what he wants to achieve, and that's why any go BP, you don't, because now you go BP, go and the rest of them. You find out that in the end, upon that Ogo BP, the only role of that Ogo BP was to reduce the fluid so that sugar level I got so high. You find out that when it takes before it becomes a problem. You know that or pushing a real question, and that's why imagon it's important occasionally you got to check it makwana or in order. So that's it for that insulin raising. Yes, it's possible for it to happen. You get, but in tandem with your physician or something over handle to and maybe change you add you weapon and the rest of them. That. So that's just it for that one. Then the question Andrew Maka alcohol brewed or not. Brewed alcohol and only had autobrewing syndrome because that's what Onya Ajuru was asking. Very beautiful. Autobrewing syndrome simply was telling us that yeast has the ability to convert your glucose to alcohol. There's a pathway for it. You get, and patients with autobrewer syndrome sometimes they eat normal food. All of a sudden they boo hakamaya. Like somebody imagine somebody no chara akpụ a na-ebu onye aka mmanya nke onye nwere alcohol or autobrewer syndrome. So the body is brewing its own alcohol from normal fermentation process, like he rightly said. But here is the reason why now the alcohol now was the part that we now said is something that is advised against. We already have a pathway where if I take in sugar through, in fact, in Nigeria, check it, sugar, yam, gare, or yam gare rice. Even beans contains traces amount of carbohydrates. So we live in a population that majority of our food stuff is already producing alcohol. And then those alcohol has two different pathways they can follow. The first part is glucose conversion to pyruvate, and from pyruvate to energy. Now, if that conversion to pyruvate now happens, and then that energy is not used up, the person doesn't use it for physical activity or rural job and the rest of them, it has to be stored. So the body can decide to store it, first of all, as glucose. Use within the next few hours. The body now converts it to fat. And we're gluconeogenesis. So glucose can lead to fat. That's why you see all those carbohydrates in the area before you know it, so that energy is now converted to fat and packed at fat, a pack here like fat pad. Imagon pad is here the entire body, pad the obi with fat, pad the afro with fat, pad the ek with fat, pad the laps with fat. So those padding now, but energy dosa, hoping that only really near will have to use that energy. Now, if the person does not keep using it and the person has that autobrewer syndrome, that glucose now can also be converted to alcohol. Do you understand? So you will find out that with increase in alcohol, normal glucose that we are eating, starch and the rest of them, I'm putting myself at risk of cholesterol, high density, low density lipoprotein cholesterol, because glucose is converted to fat. Same glucose is converted to alcohol in some cases. You now find out that in that same way, if I take alcohol and the alcohol is not, it will now, okay, the alcohol will now be converted to energy. It will be converted back to glucose, that same pathway. Or converted to glucose, the glucose are doro. So from there, that's why you see some people, alcohol is taken into the body. And then that same pathway back to glucose, from glucose as stores here as fat. You now find out that whether it is brewed or not, the fact that it is alcohol means that the body, once it takes it inside, certain traces of it is expelled in water. And some of the times, what the body expels is majority of the water and retains some of the alcohol because it's retaining it to use them and convert them to energy. Do you understand? So they are now stored as glucose. From glucose, is converted to fat. So that system is what is actually going on in the body. And that same way, some part of the alcohol is broken down. And as it's being broken down, the harmful component, the liver now goes to go and break it down. Break it down, bilirubin, biliverdin, liver, kidneys are excreting it. So what usually will have problem with those people is at first the person is taking the alcohol and the body is doing the conversion. Now don't worry, before you know it, it gets to a point where the livers and the kidneys, because of the overwork, get to a point where they cannot keep breaking down these things. Then you now start noticing acute kidney injury or liver cirrhosis. All of a sudden, the liver starts to scar because of a lot of work it has been doing in breaking down those things. And remember, that's the same way the liver is also responsible for breaking down both glucose from your normal eating and the kidney from your normal eating. So, we go the workload from the glucose in kidney from normal starchy foods that fool our country. That other one, you now find out that it becomes overwhelming for these people. So, and that's why those people will now start presenting with I say kidney failure. I mean Okulora invited people with kidney issues to Enugu, and Peter B was there. Which are 5,000 people. 5,000 people. What happened? Check a lot of them. Abo alcohol. Abo alcohol. Go and check it. The only other one now, newer traces of the other parts in Chikumaki, the dietary parts. Because Abia now, I know a lot of fake things do everywhere in the market. So even my soda drink, fizzy drink, because can make alcohol and make soda and fizzy drink. They're in the same class. My motto, my handiosa, anyone or share also. So all of them in that weight class, coupled with the fact that a lot of people now, nonsense. They people are, in fact, behind a reason poison. And for every of this poison, the reason we are not dead is because our liver and kidney has a way to break them down without us feeling it. And that's why once they keep breaking them down, it gets to a point where some of these things now become a problem. For women now, skincare, for every one of them that are rubbed on the body, it is absorbed into the bloodstream. And then the liver and kidneys have to now synthesize those ones that are bad. We break, we head down, and when you and the rest of them. So you see that work these guys are doing, because the liver also full and the kidney paired. And when damage to one kidney, you can use one kidney and function for life. But when you add the alcohol to the mix, you now find out that chances are if one gonna damage, you chop down at the second one, the second one stopped working, not to food of before. And it happens to a lot of people that don't do checkup. And we go upon the Bahia Business Clinic, upon maybe few years ago, a doctor ham antibiotics and the rest of them, he killed the first kidney. And the person did not notice because the second kidney was working. So, but the second kidney now will now fail. But both kidneys on one kedema. And these are the things I know about also, because I'm in a practice. There's only so much we know. But in Kaimagodorfoma are these ones that I'm sharing with us. So whether it is brewed or not, if it is something that can be helped, please help. But then if it is not something that can be helped, this is what I'm going to advise everybody now, which is one of the solutions I have seen to the question Adromaka or Eunaka take away Ogo BP for life. Yes, drugs like Ogo BP are going to be taken for life. The only way I've seen by research that helps people to beat every of these things I'm telling you about is a system that God put in place. And that system is exercise. I'm telling you, exercise, but not the type we do. Bronchi guy see from Waroko, see man, or whoever. No, that type of exercise is not enough to produce that significant kind of gain that you are looking for. Or mild is all moderate to high intensity exercise. Exercise get meguma also. Those are the type of exercise that is required to burn the fat. On back, my fat in afọ, fat in azụ and the rest of them. We convert where to energy. And together with fasting, some of these things that the Bible talked about, there are reason for them. Benefits. You see, fasting has tremendous benefits because when I start fasting, I cause my body to start going to bring out again a store in home. When they book the all those foreign soup, the others they can oh my key gets say KRC of us or Igana na fridge. You book the offering easy those say that's what the body does. It goes and starts bringing out all of those fats. Use be. So if I fast intermittently, I fast regularly, and add exercise to it, or the very potent such that because I've seen a lot of people, and this is the problem. Sometimes we meet some people if but still after ya dey or no ya ka still kadikwa fit still check your heart good chicken ka good every of them is good and some of the times you might even be slimmer than that person. You don't understand that that person, by that exercise, has conditioned their heart to pump blood well, has also now conditioned the body together with fasting to flush out every of those depositions so they don't get to stay. So yes, let's assume that I'm exposed to toxicities, all those things. Let's assume that I don't want to stop all these chon. I have to now build a positive energy balance. I will now come out. Now, this is what in Hindi Ochana. And funny enough, and when people, because I had to go and study this thing, it was part of the certificate I did in exercise prescription. Okay, they now show you the amount of exercise you have to do for every time. So you see some of them, I went go 1 kilo and chicken. They now check, okay, take exercise. That means tomorrow may need a also for 1 hour. You know why maybe like that, and that's how a lot of them, especially people abroad, are able to eat whatever they want to eat and still stay fit. So that's part of, and some of them they will drink whatever they want to drink, but because of that positive energy balance, they will burn all of them out in those high impact exercises that they do. But abroad, something that I will just wake up today and say, okay, can be the jogging high impact. It can be the EBD, it could be before you know it. As you know, make a jogging. These are things that you sit down with when prescribed exercise or okay, this is the one you do. This one you stop. At all. Because this is what a lot of people abroad do. In fact, even in Nigeria now, I know I've done it for some other persons, politicians, and you prescribe exercise like KCI prescribe, or okay, if you want to keep taking alcohol, the energy alcohol, this is the amount of exercise you have to be doing to burn it. Go ahead, discipline all yourself. But the essence of teachings like this, general knowledge, is so that brought somebody get discipline yourself to come out and say every morning, jogging 30 minutes non-stop to housing or something like that. It's now easier for you to say, okay, I will adopt the life of fasting. I will adopt exercise so that or balance here somehow. You see that you're way better off than somebody that just keeps doing it and then hoping on God. Okay. Then finally, in care basara the dietary intake, yes, there are certain foods already that had been banned. Canned food maybe channel, but don't judge how Nigeria and Africa can dump here. So the good counsel and amending mother advice is this: if you can get your hands off canned foods, better. Canned foods may increase risk of carcinogen, cancer, canned foods. And then also, if you can take fruits, very important. Fruits and vegetables, leafy vegetables, and we're on there now, so as each. But the problem now, sometimes we take these fruits and vegetables and then I make an arrow, but compared to the amount of the other junk, you see that leaves and vegetable are brought the solution to our problem. That's why sometimes I just mention them in passing. The major ones are these ones mentioned at the beginning. Those the junk, the abo cleaner, goko cleanser, and the rest of all those ones. Then no exercise, physical activity level. These are things that you can start changing from today. You decide, well, okay, I will start jogging. but not just light jogging now, because it has to be a type of jogging because all TCA or pump or require oxygen from various places, and it has to be controlled. It has to be something that so that can monitor it before you call you understand? It has to be monitored and tailored specifically for you. So once you do the exercise, you add fasting, especially mobile now, wago on the big side. Let's assume that they've told you your cholesterol level at wago high now, then fasting has to come in. Or they told you that you are hypertensive, or you notice you're tabago, then you have to now increase fasting and reduce the amount of cholesterol containing foods you eat. Pork meat, or fat, soya fat, even red meat, you reduce it completely. Some people say white meat, chicken, reduce or chicken, but I've come to find out that from research that chicken does not contain so much more of the calories as compared to red meat themselves. But then chicken, one of those things they tell people to don't fry it. Don't fry it, but I'm not chicken fry it. You get so, but those are the modifications that we ask people to make. So you're making modification on the nature of foods you're eating. Okay, frying. Okay, frying adiroma. Okay, frying adiroma. But the problem is this. Some people will come out and cut down on frying. I cut all down on frying, but the other things, Hannah, like maybe Agana, we get pork meat, maybe 2 or 3,000, 4,000. That is bigger than the frying in terms of the calories that you're already consuming. Even some other things like buteka, cholesterol, and the rest of them. If you cut down on those ones, you'll find out that you'll be way better off than somebody who is not engaging in any of these practices. I don't know if I've been able to touch every of those things now.
Now, Doc, thank you very much. We are way past time, so I'm gonna hand it over to Awoke, and then I'll stop the recording. I think we're gonna need a 2.0 because the engagement and the information you shared